Welcome to Select Med Tutors Quick Question Review, QQR. Today, we'll go through a classic USMLE Step 1 clinical vignette, Part 2. Let's read the question together. 1 year later, the same patient has adopted a healthy lifestyle, brought his diabetes under control, and has had normal hemoglobin A1C measurements on 3 separate occasions. To escape the pressures of big city life, he moves from New York City to the foothills of the Himalayas to experiment with a new lifestyle. Upon arrival at his new home, which is located at an elevation of 15,200 feet above mean sea level, he arranges to have his blood drawn 10 days after arrival and submitted for arterial blood gas evaluation. Which of the following set of arterial blood gas values would be most likely found in the sample? So once again, let's apply the stepwise approach that we developed in the first question. Step 1. Read the question at the end of the vignette first and quickly scan the answer choices. Once again, this is so you can gain context about the vignette as a whole and be better able to pick up clues from the vignette that relate to the question as you read through the vignette. In this case, this is an acid-based question about the effects of high altitude. Step 2. Try to think about what's happening at the most fundamental level that you can. What would you expect to see in this patient, who in the last question was very ill, but now has adopted a very healthy lifestyle? In this case, since the patient's diabetes is now in good control, as evidenced by normal hemoglobin A1C levels on multiple occasions, for all intents and purposes, we can think of the person in this question like we are thinking about a healthy patient with a normal baseline acid-base status. And what happens to a healthy person when they go to high altitude? The relative hypoxia of high altitude causes a compensatory tachypnea, which results in the patient blowing off CO2, which in turn should result in a respiratory alkalosis. Also, because the patient has been at high altitude for 10 days now, we would expect to see metabolic compensation for the respiratory alkalosis. How would this be manifested? We would expect that this patient's kidneys would allow bicarbonate to be excreted in the urine, resulting in lower serum bicarbonate levels. So, overall, we would expect to see a pH in the alkalotic range, a low bicarbonate, a low PaO2, and PaCO2. Step 3. Use process of elimination. Hence, we can immediately rule out answer choices that do not show a respiratory alkalosis, D, E, and F. We can also rule out answer choices that show elevated PaCO2, answer choice C, since that would be inconsistent with the compensatory tachypnea observed at high altitude. Step 4. Pick the better answer choice between the two remaining answer choices. Since we just have choices A and B remaining, let's see what other reasoning we can apply. Let's look at the O2 level. If we think about it for a minute, we can see that it would be unlikely that a patient who has been at high altitude would have an oxygen level in the normal range. So we can rule out answer choice A, and we arrive at answer choice B as the correct answer. So, to review briefly, for acid-based vignettes, first consider the clinical situation outlined in the vignette, then think through the pathophysiology of what is occurring to the patient and whether you would expect to see an acidotic or alkalotic overall picture. Then look at the pH and PCO2 levels. Whether you look at the PO2 or bicarbonate levels next depends upon which way the vignette is leading you. Usually, I recommend looking at the PO2 levels because in case the problem is respiratory in nature, a low PO2 will corroborate this finding. Finally, based on what the vignette has led you to believe about the acuteness or chronicity of the acid-base disturbance, look at bicarbonate levels. As you can see, using a careful, stepwise approach can allow us to conquer even a seemingly daunting USMLE question. I want to thank you for watching this quick question review from SelectMed Tutors. SelectMed Tutors combines the latest in evidence-based test prep with our outstanding MD tutors. Our services can be found at www.selectmedtutors.com.